Hello, I am Kenesha L. Davey, the Associate Director at the DC Creative Affairs Office. Welcome to our Care for Creatives community conversation. Thank you for joining us for this important conversation with Dr. Mary DeRaedt and Gary Trey Taylor about suicide prevention. After watching this episode, visit creativeaffairsdc.com to learn more about our Care for Creatives program. Through our partnership with the George Washington University, we are able to provide pay what you can mental health services to all local creatives. Thank you for watching.
Hi, I'm Dr. Mary DeRaedt, and I'd like to welcome you to the Care for Creatives Community Conversations. Today, we're going to have a really important conversation about suicide prevention. And I'm really glad to have Trey Taylor here to help me kind of unpack this difficult topic. Trey, can you introduce yourself?
Absolutely, Dr. Mary. Thank you for having me for Care for the Creatives. My name is Gary Trey Taylor, licensed clinical social worker here in the state of Virginia. I'm currently in private practice providing therapy to Black men and Black women for the past year and a half. Also heavy experience in working psychiatric inpatient as a mental health tech, and also doing crisis therapy as well, assessing folks who may be suicidal, homicidal, psychotic, or unable to care for themselves. So thank you for having me again, Dr. Mary. And could you explain a little bit more about the Care for Creatives program?
Sure. So the Care for Creatives program was really created in order to provide mental health services for people in the creative community. What we offer is basically pay what you can therapy through the George Washington University counseling clinics, the Community Counseling Services Center, both in DC and in Alexandria, Virginia. We start with a solution-focused 6-session approach and then offer the opportunity to be in longer-term therapy as well. But a part of that program is these conversations about mental health, where we want to really provide people with an opportunity to learn more about how their brains work, how their emotions work, how they are integrated into who they are as a person. So I'm really glad that you're here today and that we're going to get a chance to dive into this topic.
Absolutely. Yeah. Thank you for clarifying that. Now, I know you spoke about being in crisis and getting the mental health services with the Care for Creatives program, but can you differentiate between, what does it mean to be in a crisis versus kind of just reaching out to kind of seek out therapy services? Because as you know, some of our clientele, some people don't know the difference between, being in crisis or just trying to figure out how to find services to get therapy services. Can you explain a little bit more about that?
Absolutely, because I think it's really important, especially when talking about the topic of suicide prevention, to clarify that if you are in crisis, if you feel like you want to kill yourself, if you feel like there is no way out, there is no hope, and you are in that space, there are so many options to reach out to. You can reach out to the suicide hotlines. You can You can go to the ER, you can call 911, you could even reach out to family. But in those moments of crisis, reaching out to a therapy practice would be the step after you reach out to someone else, to the ER or family or someone, because when you reach out to therapists, what they need is the opportunity to meet you and get started with therapy and get engaged. So that doesn't happen when you're in crisis. You need other professionals to help you kind of navigate that experience. Does that make sense?
Yeah, that makes perfect sense. I think that's one good distinction to make, Dr. Mary, because when you talk about us as in the outpatient life or doing, individualized therapy and then versus crisis, right? Oftentimes they get misconstrued. So it's like, okay, well, I'm gonna reach out to a therapist. I'm in crisis right now, and you reach out to a therapist. But sometimes it might be 24 to 48 hours before that therapist can respond. Sometimes it might take a week or so to do an intake to see a therapist. So if you're in an immediate crisis, we definitely want you to reach out to your local crisis line or the National Suicide Hotline first. And then after you get squared away, making sure that you're safe, then after that, you can go and schedule the follow-up with the outpatient therapist as well. Because I think a lot of times people do get that confused, and they think that therapists have an immediate response time, but that's not the case. Probably a lot of times for us in the profession as well.
Yeah. Yeah, that moment can feel really vulnerable, and it can feel so, out of control. And so it makes sense to think, oh, in this moment, I want to reach out to a therapist. But that's not, unless you have an established relationship with someone, that moment is, you need more immediate, more direct, more specific services. So.
Absolutely. And yeah, thank you for providing that clarification. And hopefully, like, if anybody that's feeling those thoughts, they can reach out and get those resources that's needed as we continue to go through this actual interview process. So a lot of people have these conversations around, okay, I'm depressed, or I'm having thoughts about wanting to harm myself, or I feel down, or I feel hopeless, or feeling like they want to harm themselves or kill themselves in that very moment. How do we differentiate that? I know as professionals in the field, we have our multiple layers, different ways of how we assess that and work through that. But what would you say is a way to kind of help for the person who is not, the everyday person who doesn't understand the field as much, to differentiate between what's being hopeless, sad, versus being sad or down, versus having thoughts about wanting to harm themselves with a plan, things like that?
Yeah, I think you just said it, which is one of the biggest ones, which is that do you have a plan? Right? Yeah. We as human beings have ebbs and flows to our emotional state, right? We sometimes feel really down, we sometimes feel really sad. But when you are in a space where you feel totally hopeless, you think there's no way out, you don't know where to go, and you don't know where to turn, and you are thinking that killing yourself is the option, and that is a time to reach out. That is a time to engage in a crisis service, to contact someone to get the support you need. If you are in a position, and I'd love you to expand on this as well with your experience, but if you're in a position where you're kind of consistently feeling down, and it's starting to become overwhelming, and you're starting to just kind of for the first time have these thoughts of hopelessness, or I'm not sure if there's a way out of this, then that might be a space to reach out to a therapist to get started with therapy and to begin the process of discussing that and unpacking it. But I'm wondering what your thoughts are on that.
Yeah. That's really layered, and I have to make sure that I look at it from different lens, in reference to somebody that's coming in for a crisis versus an outpatient setting. Yeah. And so when you start thinking about the weight of the world, I kind of define mental health as how we deal with day-to-day life stressors, and that could feel heavy at any given time. Yeah. Now, there's a situation where feeling hopeless or feeling down or feeling sad about life but I still want to live life. I'm still functioning. Things are getting paid. I'm still taking care of my responsibilities, right? And I'm still thriving in a sense. I might be drowning a little bit. I might be struggling to maintain and manage these things. I'm aware and recognizing what's going on, and I know I need some little bit more of assistance. I think you said it the best, Dr. Mary. Then that situation is where I should probably reach out to a therapist to work on my stressors, right?
Yeah.
And figure out how do I better manage some of these things going on, or I just feel off, I feel more down, my emotions are not at the same place, my mood is kind of up and down, just not really myself anymore. And I think that's a perfect time, even let's say, even if everything is going well and you just kind of want that added support because of the type of stuff that's going on, type of maybe work you do or things you may engage in, you're dealing with family problems, relationship stuff like that, you want to make sure that you're your best self. That's the point in time where I feel like, yes, go and reach out to a therapist, right?
Mm-hmm.
And get started in that outpatient realm. It's not to say that those who aren't having those same struggles, that have some thoughts about wanting to harm themselves that comes and goes, but they're still functioning, can't do the same. But if you're looking for that immediate need in reference to having thoughts about wanting to harm yourself, or feeling suicidal at this most with plans and possibly intentions, then that is the point in time to possibly go for the crisis realm first, the ER, local community service boards, National Crisis Hotline, this, that, and the third. When it's so overwhelming where you have a suicidal plan, you have a thought, a plan, and then you have intention on going through with this, it's all detailed plan, then that is the time to reach out and go to crisis level, because you won't be able to get your immediate needs met in that current moment if you are having all of those in one. And so that doesn't mean necessarily that it still can't be in the same vein as somebody who's dealing with all the other stuff going on as well.
Right.
But managing, but still maybe having some thoughts that come up here and there that you can't reach out to a therapist and go about doing that. But just understand that it won't be an immediate response at times. So are you willing to wait that point in time to see somebody, to a therapist to respond back, to come back to you? Or if it's immediate crisis need, mental health or substance abuse, or the suicidal ideations and plans, then that's the point. We need to go 24/7. So that is kind of where these things weigh. It doesn't mean they don't intersect. They definitely intersect. And you have to be, I know sometimes it's hard to even rationalize what's going on in those moments. Maybe having somebody that you can reach out to that you trust or support to kind of help guide you on what's the best decision. Should I go find a therapist right now, or do I need something immediate today? Then if that's the case, then we go to the crisis line or to or ER or something like that.
Yeah. I think I really love what you just said. And it brings up something else that I've been thinking about, which is that you may be someone who maybe you don't think that you're at that crisis point. Maybe you think that you're just feeling hopeless, and you've thought about a plan for how you would do this, but you don't know that you're right there, but you need help, and you don't know how to reach out to a therapist, or you don't know what the next step would be, and you're feeling unsure. You could still reach out to the crisis line.
Right.
You could still connect with the people who are on the other end of that crisis line, because they can give you steps. They can help you figure out what to do next, and know that there is something next. There is a next step. And so whether you're all the way to the point of wanting to and planning to harm yourself, or you're thinking about it and unsure how to get help or where to go, you can still call those crisis lines, right? You can still engage with them, because maybe you don't have family and friends that you feel comfortable talking to about it.
Right.
Maybe that's not the direction that you want to go. And so this is an anonymous option to call and just get some information, get some help in that moment.
Yeah. And I think the crisis therapist working with, working in that space for 3.5 years, and knowing the people that I work with, those conversations were because we man those phones 24/7. And we have those conversations with folks to kind of help de-escalate them, even if you're not suicidal at times. You know what I'm saying? Like we can de-escalate a situation if you help talk to you, help process it through. and then figure out what's the best option. So then that, like you said, like I think you brought up a great point. Like you might not have friends or family that you're comfortable with speaking with, but this non-biased opinion from this person on the line can help you process and work through that. Do you need to come in for an assessment? Do you need to we need to give you some resources to figure out some therapists to call? Do we need to set you up with an outpatient therapist to get squared away? Are you safe? Are you in a good space right now to do that? Do you just need somebody to process and talk? And so, those are options as well. They also have warm lines out there for people who are just want to, get some stuff off and talk to them as well. That's not on a crisis level as well too. So there are options out there. It can seem intimidating. I understand. Especially, not knowing this person and, what could be the repercussions of it. But these lines are out there to help you, guide you, and process through that so that you can make the best decisions possible, but also make sure that you're safe as well. So, yeah, absolutely.
Yeah, that idea that you might not know this person. I know for some people, the knowing somebody makes it easier. And for some people, the not knowing that person makes it easier.
Right. Absolutely. Absolutely. So yeah, we always got to take that into consideration. Absolutely. So as we continue on, somebody might ask, okay, well, what are the warning signs, right? What are the warning signs of suicide? What do we need to be looking for as maybe a friend, a family, spouse, whoever else, a care loved one? What are some warning signs that you think of, Dr. Mary, that people should be looking out for?
Yeah. So I think just as a starting point, because I would love to hear your thoughts as well, a starting point is that, first of all, if you're thinking about it, right, if it's on your mind, if you have considered it, that is a point at which you want to think, okay, this is a warning sign for me. I'm thinking about ending my life. And that it feels hopeless, that feeling of hopelessness. Those are both, we've talked about that a lot today, but those are both really important indicators. One that I think isn't often identified is feeling trapped. So quite often that feeling of like, I don't have anywhere to go. I have no other options. I feel trapped, whether it's trapped by like economic issues, trapped by relational issues, trapped in all the areas of your life. That feeling of trapped can really push you into a place of hopelessness and not having any direction to go. So I think feeling trapped is one of them. Another one is just kind of the idea, believing the idea that you're a burden to others, that you are going to you're dragging people down. This isn't true. And I've done another talk on emotions lying to you, and sometimes emotions lie to you. And this is one of those times where, when you're starting to think that way, that can kind of be a warning sign. So, I mean, I think those are some general thought processes that go on for people. Are there any other indicators that you would want to bring up?
Yeah, so I think about a couple of graphics that I shared in the past around suicide prevention and like some warning signs, which, as I, go through my career, often like a lot of these symptoms intersect and overlap, from actual mental health, mental illnesses, this and that, and the conditions that pop up. So like when I think about loss of interest, right? Loss of interest in certain activities that are usually one with love, right? That is one. Displeasure in doing those things anymore. Definitely the hopeless feelings. Isolation, right? Isolation and fear. We all have been through COVID and this pandemic, right? And so a lot of times it's been, pushed to ourselves to be by ourselves alone. That's isolating. That can be fearful, and it can be you can feel alone and lonely. And that can lead into, those thoughts about, am I even worthy to be here, or anybody cares for me in these moments, right? Yeah. Other symptoms, look at sign symptoms are like, maybe person is selling everything off. Like they're selling all of their items off, everything they earn, they love, they selling it all in a random fashion, right? And then also just irritability as well, just not being themselves, mood regulation changes, things are just happening so fast. I love the piece of, being trapped, right? Because looking at what we're going through right now today, everybody can feel trapped at some moments, right? Whether it's financially, whether it's career-wise, and those conversations, or lack there of conversations, lend way to you staying in your thoughts, staying in your mind, and any thought, all these thoughts come out of nowhere, and you just too much pressure for you to even deal with them and approach them. So I think that, and then also like person talking about death a lot. Right, like there's an uptick in more conversations around death, or the passive thoughts. I wish I wouldn't be here anymore. Or it would probably be just better if I just died or wasn't here anymore. Like those kind of thoughts that kind of slip in sometimes, where we kind of just play it off as if it's not nothing, but that's some of those little red flags, those warning signs that something else might be happening, going on. So those are kind of some of the generic and a little bit more specific ones. They also intersect with different mental illnesses such as depression and anxiety, this, that, and the third. And so you'll see those symptoms pop up even with somebody who might be dealing with depression. Depression and suicide have a high correlation as well. So things can get really tricky really quickly if the help and interventions is not put in place. So, I think with that being said, those are those signs, but also want to definitely understand too, because a lot of people ask, and this has been my experience as well, you can't predict either. So I think the biggest piece in also prevention and also the warning signs is treating people with love and care and compassion and respect. So understand and being more authentic and genuine for our relationships with each other, to foster environments to where it's safe enough to discuss what's really going on in these moments. I think that's one big thing that I harped on when I had a conversation earlier a couple of years ago around suicide prevention, is treating people with love and compassion, and managing these relationships so that if something does happen, or if God forbid, or a crisis happens in a moment, that person feels safe enough to come and talk to you about what's really going on. We both have an understanding, and we can both work together to find those needs. And so I think that goes untapped and missed, right? In these moments. So those are some other things like that. 'Cause like I said, it's very hard to predict. And I have no formula to predict it outside of these signs and symptoms that intersect and overlap, because I've seen it on both sides. But that compassion and caring for others goes a long way.
Absolutely. There's a couple of things you said that I just wanted to kind of reiterate and follow up on with you too, because I think the one that stands out to me is that with the pandemic, with the staying at home, with this isolation, and even mask wearing where we're not seeing other people and engaging, our brains are wired to interact with other people and to get that back and forth communication going on. And it alleviates our stress, it alleviates things. And it also just talking about something gets it out of our head.
Right.
And so when we're isolated and something is just running through our head over and over again, it can drive us down a path that we wouldn't have gone on before. And so if you were already experiencing some depression and anxiety prior to the pandemic, and then you're isolated for 2 years, just being aware enough that you need to have an opportunity to talk, you need to engage in, with other people and talk about your feelings and get them out is a really important point for all this. But I think the other thing that it occurred to me while we were talking that can be a sign for people who are experiencing it, and potentially for people out in the lives of people who are experiencing depression, is increased substance use.
Yes.
And an increased reliance on substance use. You may find yourself having had, drinking on a social basis prior, and then little by little, you're finding yourself isolating more often and drinking alone, drinking on your own, drinking more than you drank before. And that could go for other substances as well, if you're using them. So, and maybe even sometimes overtaking psychiatric medications. Relying more heavily and feeling like, well, I need to take more of what I've been prescribed. I need to take it more and more and more. So being aware of that as kind of a sign or a symptom, I think, is another really important one.
Yeah, definitely. I forgot we talked about that. The increased substance use, that can definitely be definitely a warning sign as well, due to the unintended consequences, as a result of that. You know what I'm saying? So, and that could be so very easy with the pandemic and everything that's been happening. Like, well, what I'm saying, I'm just here. It's here. Let me just do it, and then it just keeps increasing. And I talk about it a lot, like, what I'm saying, with understanding, like, okay, well, you're using this, right, socially or recreationally as a point, right, but then are you using it to cope, right? If
Yeah.
you're using it to cope with your mental health issues or whatever you got going on, then that's where it starts to, it ramp up a little bit, and that's where addiction and mental health go hand in hand. So what are we looking to cope with? How are we going about coping with it? And then it can go either way. It can go either way, for sure.
Yeah, so this kind of brings up another really important aspect of this topic.
Absolutely.
There are both the people who are experiencing depression and significant suicidal thoughts. And then there are the family members and the people around them. And you kind of touched on already the idea that we can't predict, right? Like we can't know for sure. We can't, even though we're therapists, we're not mind readers.
Right. Right.
We can't read each other's minds. So we can look at symptoms, we can look at signs, and then we can express concern. And so I guess I'm wondering, what are your thoughts on how people in the lives of others, if you start to recognize that this person you're worried about them?
Yeah.
What are some things you could say?
Yeah, that's a conversation, I think, around with family members and friends, man, that I've done a lot more dialogue with in my years, because it's scary, right? Yeah. And scary, and you bring up suicide, people automatically panic, right? People automatically panic, and then they want to do everything in their power, or they get upset that this person is thinking this way and start to impose or project their own ideologies around why they shouldn't be thinking like this, and they have such a great life, and it's like, well, obviously it's not as great as you think it is, and obviously they are struggling with something, or they're dealing with something, and they don't know any way out besides this. And so going back to my conversation about like how family and friends can really show up in a prevention space that doesn't look like just warning signs and symptoms. Also definitely being aware of that. But again, how are you providing space for this person to express themselves, right? Yeah. Are you shunning them away or dismissing their experience or what they're going through from a mental health perspective? Again, like I said, mental health is a daily thing. I feel like, is mental health is how we deal with day-to-day life stressors. So are you constantly dismissing if this person, family, friend, loved one is coming to you saying, I had a hard day, and, this really struggling, dealing with this, and you say, oh, well, it is what it is. And just really dismissing what they're feeling, right? And so obviously that's okay. Well, Trey, that's something small. How does that impact? But if this person is struggling, right, with self-worth, self-value, or maybe they having depressive symptoms, anxiety symptoms, or maybe they are feeling where they don't feel like they can contribute to society, you, in that other hand, on that aspect, are only confirming how they really kind of feel by dismissing what they're going through, right? That's just a little small example, but it goes a long way to help have conversations with that person, to help flesh that out, to be a lending ear, a shoulder to lean on, regardless of how they feel. And so that's why I say that we kind of got to get back to this compassion piece of one another, and extending that grace, extending that arm out to the point of where people can feel safe enough to talk to you about these things, right? Mm-hmm. To let you know what's going on in their lives. And it starts, I believe, not when the crisis happens. This starts, Dr. Mary, I feel like days, months before, right? When you are struggling or you having a hard day,
Yeah.
If I'm coming to talk to you, Dr. Mary, and I say, I'm having a really hard day in the field, this, that, and the third, and you dismiss me, right? Then am I really going, or you dismiss my feelings, right? Well, hey, Trey, but that's how the field, you know what the field, this is what the field is, right? And I just feel, okay, well, I didn't get out what I needed to, and I didn't express everything I need to. Am I really going to come back to you at my deepest, darkest, lowest moments and let you know what's going on when you couldn't even handle the fact of I just had a hard day today?
Yeah.
Yeah. So I think that prevention, I believe, starts early, way early on, before it gets to a intervention, before it gets to the crisis moment. And I think as everybody right now is experiencing the pandemic in their own way, regardless if you're a healthcare professional, mental health professional, 9 to 5 everyday citizen, whatever you're doing, creatives, this, that, and the third, trying to put these products out, this, that, and the third, that it is imperative that we give each other grace and the space to help, express what's going on in our lives. And then talking with one another, getting back to at least that, or engaging socially with some people, and figuring out, kind of working through all of this, because it's a big weight for everybody. It's a big weight for everybody. So to dismiss one's feelings and emotions relegated to that experience because you don't perceive it as an issue, right? Or you don't perceive it as a big of a deal, is not doing anything to help the person that you love, care for, or, care about. So I look at it from way before we get into that space.
Yeah. I have to say, Trey, I'm sitting here thinking, I think we have the new PSA, which is prevention starts with early compassion.
Yeah.
Right. Prevention starts. I love what you just said. It's when we tend to, I think as human beings, and I think you would agree with me, we tend to throw things around sometimes casually, like, oh man, I just want to kill myself, or oh man, this day is the worst day of my life.
Right.
And because we do that, we ignore each other. We miss things. We don't hear the pain behind those words. If someone is saying that, there's pain behind those words, and we don't take the time to recognize and just go, can I check in with you about that?
Yeah.
How are you doing?
Yeah.
How are you doing about that? How are you feeling? You've been through a lot. Or maybe I don't even know you've been through a lot, but what you're saying, I'm noticing, and I'm having compassion for where you're at.
Exactly. And I think that's one, just meeting the person where I'm not saying you have to do a full assessment to be a therapist.
Right.
But just extend a hand, right? Be compassionate. We all in a pandemic, we're all struggling. And people deal with things differently. Some of us, that things get to us differently. And it's one thing, Dr. Mary, I tell parents too, right? Like parents will, come to me and say, well, nah, Trey, my child is doing this and they doing that. I don't know why. They said they was, suicidal, standing there. I don't know why, because they got this going on, got that. And I'm just like, well, how are you modeling, right, what it is to manage your emotions and your mental health in front of them? Right. And are you giving a space and opportunity for them to come talk to you about what's bothering them? Yeah. Regardless, before it gets to a crisis. Right. We have to establish that up front. Because then I can feel like I can trust you enough to bring something that dark to you. And so with that being said, parents and everybody else when that does happen, right? Let's say somebody does trust you enough to say, well, I'm gonna, bring this, what I'm feeling. I might be suicidal. I might be having fleeting thoughts, thoughts I don't want to be here anymore. This, that, and the third. There's no place for you to judge them. Yeah. There's no place for you to judge them. And then give them a lecture or spiel about why their life is so amazing and life is so great and they have everything to live for. That's not a space for you to do that current moment. That person is coming to you at their lowest moment and they're really struggling with something and they just need to be heard, right? Not lectured. Yeah. And then we have a conversation about that and you let that be known. You support in any way, shape, form you can. And then you come up with a plan to figure out what's next. What do we need to do next? Do you feel like going to talk to somebody in a crisis level? Do we need to go help you seek out some therapy? Are you safe right now? I'll stay with you. I'll be here with you. I'll take off. you have to craft that plan together with that person and not just react and start to project your own fears and anxieties on that person, because you're only just making it worse at that point.
Yeah, that's such an important point, because I think first of all, if we're there and we're present and we're engaging in a way that's compassionate, then hopefully the crisis won't happen. But then when the crisis does happen and you're aware and we become aware that someone that we love and care about wants to hurt themselves, wants to potentially even end their life, it creates a crisis on our part. And there is a tendency to want to jump in and fix it.
Right.
And fix it by saying, you're fine, you're good. There's all kinds of, there's no reason for you to feel this way. You don't need to be feeling so bad, because we're trying to solve our crisis now. We're trying to fix our side of it. And go, I'm going to fix this for you. I'm going to solve this for you. Mm-hmm. I'm going to say, that's the other thing. I think we feel like I'm going to say just the right thing that's going to stop you from being suicidal in this moment. That's going to stop you from feeling this bad. Mm-hmm. And we lose track of, in that moment, the fact that really the thing that people need first, it's like triage in hospitals. It's like, what do you do first? First, you listen.
Right.
First, you listen.
Mm-hmm.
You have compassion, to your amazing point. And then once you've listened, once you hear, once you understand a little better, then maybe let's reach out to someone else. Let's come up with this plan. Let's engage together in, not I'm going to solve it for you, but let's figure out how to solve it together.
Yeah. Absolutely. There's no savior complex in this. This is me meeting your needs at this point.
Yeah. So I think one of the things that we haven't quite hit on yet is that, suicide impacts people across all kind of genders, socioeconomic status, race, age. It happens across the lifespan. There is a tendency in adolescence for there to be a heightened experience, because everything is so much more intense and everything is so much more kind of unstable, and identity is unstable, but it impacts everyone. And I'm wondering if you could talk a little bit about how we see that impacting people differently across different communities.
Mm-hmm. Yeah, absolutely. I mean, I think suicide, it doesn't have no discrimination between, age, gender, race, this, that, and the third. It definitely does not discriminate in that aspect. But there are other places where, different races and genders that, age groups that suffer with it more. And it's coming to a point where, as some of my colleagues that I've worked with on the public health side, where it's a public health emergency, it's a public health issue, especially for us for folks in the Black community, where, suicide rates are like top leading cause of death from our young kids from ages 7 all the way up to our young adults at the ages of 21. And so when you start talking about discrimination or income gaps, income inequality, access to mental health care, access to affordable insurance, these systemic based issues, maybe even like a food shortage, right? A food desert where we don't have access to nutritious food every single day, right? These are the systemic factors, the socioeconomic issues that plague, right, certain communities that also aid in the actual mental health of those communities, which then also leads to the suicide rates as well. And it's all intertwined. That's why I always say mental health is how we deal with day-to-day life stressors, because everything you come into contact with socially, right, can potentially be a stressor. So if when I wake up, I know I got to go to work. That's a potential stressor. Mm-hmm. Bills due, food, the gas right now, taking care of my kids, taking care of my family, career. These are all stressors every single day. It's not like we just wake up and it's just everything is good, right? It's just something has to be done. And then that's magnified for, communities of colors, right. Black folks, Black population. That's magnified to a different level, because when you throw in, racism, this, that, and the third, that gets magnified. Why am I here? If this continues to happen to me, why am I living in poverty? and I can't get out. It doesn't feel like, going back to you, I feel like I can't get out. I feel like I'm trapped, right? With all this around me, I can't go anywhere. Then that consumes you to the point where you can't even think outside of that and go successful. So that is where the systemic issues also push on the mental health conditions. This is one thing I've always talked about, is until we understand that mental health is also tied into our systemic issues, then that's when the effective mental health treatment will start.
Yeah.
Because that's when we'll solve these crises going on. Because yes, and I think too, Dr. Mary, you gotta, understand from folks, like, sometimes, I think we make life look easy, right? Career, job, family, everything's fine. Bills, we're making it, right? But let's not negate the fact that it is very hard to be an adult.
Yeah. Yes.
It's very hard to be an adult. Adolescents, of course, like school-wise, it's not, there's a lot of societal pressures on them, and they have to perform. They have to come up in these different, they have to they have to be in these spaces in order to graduate, to get to this next level. But adulthood, right? It's stressful. Yeah. It's very stressful. So I think sometimes we normalize it. We normalize it being stressful and assume that everyone should be able to get it and do it.
Yeah.
And that's not the case.
Yeah.
From an economy standpoint, everybody can't afford to pay a mortgage. Everybody can't afford high-end rent. Everybody can't afford to pay for expensive groceries all the time. Everybody can't afford a reliable vehicle at times, right?
Yeah.
And what does that look like? Everybody can't afford to go to school and graduate and get degrees. Everybody can't afford to just create and do things.
Right.
You feel what I'm saying? It's just not.
Yeah.
It's not. I think, but that's the assumption, and so that's where I see, that kind of intertwine in socioeconomic and systemic issues.
Absolutely. I think when you are in a position where yes, it's hard to adult, and I totally agree. It's hard to have to navigate, regardless of your there's a lot of things that play into it. But when you are in a position where you have never known where the next paycheck is coming from, you don't know if there's going to be food on the table next week. If your car breaks down, you can't go to your job. Then when things happen, when you go through day-to-day life, they weigh on you. When you were talking about it, I think about the community, the challenges in a community press on the people in the community. And that pressure in marginalized communities, in communities of color, when it's low socioeconomic status, when there's this consistent day-to-day pressure on you, it can feel like you're trapped. It can feel hopeless, and it has an intergenerational effect on emotional state, on depression, on anxiety, on all of those things that make you more at risk to feel like you have no other option. You have no way out. And so supporting people in that environment is so important.
Right.
And changing that environment, to your point, changing that environment.
Yeah, I mean, the changing the environment and addressing those needs are one of the things that we can help in suicide prevention, right? If I don't know if my next meal is coming from, if I don't know how I'm gonna pay this light bill, I'm gonna get these groceries in here, then why should I, continue on, right? So I'm not providing a healthy space and environment for my family. It goes beyond just getting a nice car, a nice vehicle. It's just how can I sustain on this income due to these systemic issues where I'm not granted the opportunities to succeed. And that's what really bothers me and really on a kind of a macro policy level. That it bothers me that we can't recognize that. We can't see how that impacts us because we just assume. Yeah. And it just really bothers me because I tell you one thing, where we looked at when I was working in psych inpatient, where it kind of got my passion to do more stuff was, I was looking at person and environment. At social work, we always taught how do the environment affect the other person, the person who's in it. And I looked at it and I was like, okay, this person comes in to the psychiatric inpatient. They may have, thoughts about wanting to harm themselves, or may have had an attempt, or, this, that, and the third. They was really down and upset and sad and really just wanted to end their life, right?
Yeah.
So they come in to get treatment, right? But then they go right back to the same environment. And it's like, well, what are we doing to address the environment? Oh, well, we gave them the outpatient resources and got them set up with a therapist, a psychiatrist. Great, right?
Uh-huh.
It's only so much therapy I can do if you're not getting paid enough to keep the lights on.
Yeah.
It's only so much therapy I can do. There's no intervention in talk therapy that says, okay, well, outside of me cutting the session off and saying, let's look for some new jobs, some career path, or some income resources. That's part of my, if I need to do that, I help that out as well if I need to.
Yeah.
But there's nothing I can tell you that's going to help you kind of manage this besides putting you in place with the resources that's needed, but the resource is not there.
Yeah.
You feel what I'm saying? Then what are we doing?
Yeah, absolutely.
Yeah.
And all of those things, and I know we're expanding beyond our topic a little bit of suicide, but I think that all of those things are not in place with communities that are having ever increasing rates of suicidal, attempts and suicide. And so I think maybe just keeping in mind that if you are in that position, if you are in that situation, that there are people who understand,
right,
that there are people who get that this pressure, this ignored status, this challenge is impacting your mental health. And there are people that can help.
Right.
I think that that's an important thing. And honestly, it's one of the things about Care for Creatives that I really wanted to be made clear is that while we can't solve all of those problems, you can at least have someone who you can afford
right
to talk to on a weekly basis. There are people, there is affordable therapy out there, where while it can't solve every problem, it will make you more equipped to maybe solve some of those things for yourself. So yeah, I think it's such an important part of the issue is how are we providing supports for people?
Yeah, it gives an outlet. And I'm not saying that, I'm on my soapbox about therapy can't help. It definitely can help. And I think it gives you the outlet and place. I'm sorry about that. Gives you a place to process that. But if we're talking about suicide prevention, then it goes beyond the therapy seat.
Yes.
It goes into the environmental and social economic issues that plague folks who do come to therapy because they can't get their needs met in these spaces. That's all I wanted to clarify and say.
Yeah, 100%. 100%. I totally, it's just true. I don't even have to agree with it. It's just true.
Yes, indeed. So, it's so much more. I know we can go on and on for days, especially for us as clinicians, in this space. Yeah. But, are there other resources you know of, Dr. Mary, outside of Care for Creatives as well that can, help folks who are watching, point them in the right direction?
Yeah, I think resources in terms of where we have provided at the beginning of this, and we will provide it at the end, multiple hotlines, a very long list of people you can call. And I think making use of those can be challenging. It can feel overwhelming, but really you can even text. There are multiple texts if that feels safer for you to reach out. So making use of the hotlines and recognizing that there is help out there is an important resource. I also think talking to people, just saying it out loud, how you're feeling to someone else. It's not necessarily a specific resource, but there are people around you and they do care. So reaching out to people who are in your environment and just saying out loud how bad you're feeling is a good thing. Also, I think educating yourself on mental health issues on some of these topics. There are multiple websites that talk about ways to kind of take care of yourself if you're feeling extremely depressed. Options for books, if that's how you're inclined. I'm going to be honest, I'm a little more inclined toward listening to podcasts and, even sometimes some YouTube videos about just learning about mental health and learning about your mental health, so that quite often you can hear something and go, oh, wow, that's me.
Yeah.
And I didn't even realize it.
Yeah.
Yeah. Are there anything else that you would recommend, specifics?
Yeah, so of course, the resources we put in the lines we put in the beginning and the end, but I wanted to explicitly say those as well since I'm in Virginia. So and I get this a lot. I actually will meet with clients. A lot of clients don't know that their locality in Virginia. I don't know about Maryland and DC, but each locality in Virginia has their own separate individual crisis line that is manned 24/7. So it looks like the National Crisis Hotline. And usually if you call the National Crisis Hotline, they may refer you to one of these CSBs with their crisis line and get you connected to somebody that's local, right? Yeah. So what happens is community service boards or behavioral health authorities in Virginia are the state entities that provide services, individual therapy services, substance abuse services, intellectual disability or developmental disability services to those who may have low income, no income, or no insurance. And so you can go there, you can get set up to see a psychiatrist, get set up to see a therapist if you need that, substance use, all those resources are there if you're in the state of Virginia. And they're all around. And so I know for the DMV area and Northern Virginia, I listed out all of those for Arlington County CSB, Alexandria City, Loudoun County, Fairfax Falls Church, Prince William, Manassas area, and then also Rappahannock Area Community Service Board, which is close to my hometown, but that also covers like Stafford, King George, Spotsylvania, Fredericksburg. And so I wanted to provide that, but they have CSBs throughout the whole state that do just that work, and wanted to give that opportunity so you can kind of understand. No, because a lot of people don't know what these CSBs and behavioral health authorities do. So right. I want to clarify that for folks who kind of like, if you need somebody to reach out to in a 24/7 as a crisis line, you don't have insurance, you only have Medicaid, you can't find any providers, that you can go to these community service boards of behavioral health authorities and get some immediate treatment should you need it. Other folks my colleagues in suicide prevention that are worth listening to at a higher level from a state and federal level, Brandon Johnson, Black Mental Wellness Lounge. She's also a public health advisor and major expert in suicide prevention. Dr. Alfie Breland Noble with the Coma Project. She's in Arlington. She's working with adolescents, youth for minoritized or oppressed populations and in suicide prevention. And I think also Janelle Cubbage, I think she's in Maryland, I believe. She's a suicidologist studying suicide in that aspect as well. So if you go check those folks out, they have links up there, videos, websites. They can give you even more information at a broader scale around what suicide prevention looks like, because it's different layers, Dr. Mary's different layers. We got it from the federal state side, public health side, from our side, the clinician world, even down to the ERs and the crisis centers. So, and I think Virginia is revamping their crisis system to meet the need as well. So we should see hopefully the results of that in the next couple of years to kind of grasp this mental health crisis in a better, more succinct, quicker manner.
Absolutely. I love all the specifics of your resources. That's wonderful. And I think the only other one that popped in my head as you were talking is that for some people who could maybe afford kind of a mid-range therapy option, there are a lot of different online therapy options now available as well. That again would be after the crisis, not in the midst of the crisis. I just want to make sure I clarify that. So Trey, maybe you could, first of all, thank you for having this conversation with me today. I really appreciated benefiting from your wisdom and expanding my understanding of this topic, because it's a complicated one and it's a challenging one. And I respect all the experience that you bring to it. Is there a way that people can kind of get a hold of you, can connect with you in some way, social media or other websites?
Yeah, absolutely. You definitely can follow me on my website. My website is www.uphold318.com. And then also you can follow me on social media. I'm on LinkedIn as Gary Trey Taylor, LCSW, social media, Instagram is retro, RETRO_GT, which is also the same for Twitter as well. And so, if you need to connect with me, or just need to get pointed in the right direction, I can help point you in the right direction. I can't obviously give you therapy in the DMs, of course, but if you need resources, need a speaker, need a facilitator, or just need to kind of just like, can you point me to somebody that, knows more about this subject matter or expertise, or resource, I can get that to you as well. So thank you for having me, Dr. Mary. I appreciate Care for Creatives, definitely.
Absolutely. This was an excellent conversation today, and hopefully someone can hear it and help. Thank you for watching this Care for Creatives community conversation. To learn more about the Creative Affairs Office and Care for Creatives, visit creativeaffairsdc.com. Thank you for joining us.
Thank you, Dr. Mary and Trey, for participating in our Care for Creatives community conversation. For everyone watching, visit creativeaffairsdc.com to stay up to date on all things Care for Creatives. Until next time, take care. In closing, here are a few helpful tips and resources. Pay attention to warning signs. Call a suicide hotline if you are ever in crisis. National Suicide Hotline, 1-800-273-8255. National Association of Mental Illness. Learn more at NAMI.org. The Acoma Project and Dr. Alfie Breland Noble. Learn more at acomaproject.org. Black Mental Wellness Lounge and Brandon Johnson, MHS Public Health Advisor. Search the Black Mental Wellness Lounge on YouTube. Janelle Kubach, MS LCPC Suicidologist. Learn more at ubuntuhealing.org. And the Care for Creatives program, Pay What You Can Counseling. Learn more at creativeaffairsdc.com.